All right, we're going to start Unit 2, which is going to go over all of the bones and the muscles in the body. And we're going to work through the muscles and the bones in particular order. So there is what is referred to as the axial skeleton, which consists of the head, the vertebral column, and the ribs, and then what's called the appendicular skeleton, which are the limbs essentially and the hip bones. So we're going to start working. The next series of lectures will talk about the skull bones, what bones are made up of what bones make up the skull, and then some of the features that you're going to find on these bones, which we will look at during lab. And then finally, we'll talk about the muscles that attach to those bones. And then we will systematically work through the axial skeleton. So there'll be lectures that systematically start working through the vertebral column, the rib cage, and then we'll move over to the appendicular skeleton. So that'll be how the lectures are arranged for Unit 2. So today's lecture is going to focus on the skull and the features of the skull. So before we kind of get into and start talking about all of these different features, there are going to be some terms that you'll hear me use a lot throughout this lecture, and I've summarized them here. They're also in your lab activities, so just kind of start working on defining these and getting used to using these terms when describing features of the skull. So I'll go over them here, but throughout the lectures, pretty much throughout this whole unit, we're going to talk and use these kind of terms. So for instance, when we're talking about the features that you will find on bones, you'll often hear me refer to a tubercle. And a lot of these have to do with bony protrusions. And it ends up being that there's multiple ways to call a bony protrusion. So some of these are a little redundant, but they still cannot be interchanged. So a tubercle is a small rounded projection. And I'm not going to go into where you're going to find them just yet. I just want to introduce these terms, and then I will show you specifically where you can find them when I have pictures of all of the bones. A tuberosity is also a protuberance in a bone. So you'll hear the word tuberosity. Malleolus, that is another type of bony projection. A styloid process, there's actually going to be one when we talk about the skull, and that is a slender projection. And you can kind of think of it like a stylus pen. It kind of looks like the tip of your stylus pen. A facet is where two joints come together. There's also going to be a couple facets on the skull. You're going to see this on the vertebrae as well, because the bones stack on top of each other. And so the area where they meet, that is called a facet. A condyle is a rounded protuberance. And then we'll talk about a sulcus. You'll see it in the skull. We'll also come back to this term when we're talking about the brain, when we get to the nervous system. But it is a groove. And then fossa, we'll see a lot of fossas. These are shallow depressions or smoothened areas within the bone. A meatus is a passageway. It's kind of like a canal. And a foramen, which you'll see a lot of, is an opening or a hole. So lots of times there's going to be foramens in various places, especially in the skull, because it is a passageway for blood vessels and nerves. So the goal of this lecture, and for when you are in lab, is to be able to identify the bones that I go over and identify the features of those bones. So you will want to use, a lot of my images are cartoon images so that I can really stress where the feature is. But the goal for you is to take this lecture and sit down in lab with each of these bones in your hand and try to identify these features. The way that I have this lecture organized is I first talk about the cranial bones, the bones that kind of house the brain, and then I go on to talk about the facial bones, okay? And the way I organized my lecture is based on a mnemonic. And you do not need to use this mnemonic, but it may help you remember which bones are part of the cranium and which bones make up the face. It's entirely up to you. I found this mnemonic when I was watching videos on trying to come up with ideas to help students memorize these bones. So if this mnemonic works for you, that's great. If not, you can disregard it and come up with your own method. That is entirely fine. All right, so let me orient you. Let me get my marker here. So again, we're gonna first work on these cranial bones here. These are the bones that house the brain. And the mnemonic, if you need it to help you memorize which bones make up this part of the skull, is 8 osseous parts form the skull. And remember, a mnemonic takes the first letter of each of the words to help you memorize these bones here. So we're going to go through these bones, and there are features that are important to each of these bones so that when you're looking at the bones in the lab, your job, your goal is to identify the features that go with them. So we will talk, and I'll go in the same order to kind of give structure to the lecture. I'll talk about the ethmoid bone first. Okay, the ethmoid bone sits right behind the nose, so it's kind of hard to see. You almost have to have it out of the skull, which we do. We have an isolated ethmoid bone, so you can look at the isolated ethmoid bone, but it sits right behind the nose here, the nasal bones. That's what's shown in red. We're going to talk about the occipital bone. That's here in green. That's the bone at the back of the head. We'll talk about the parietal bone. There are 2 parietal bones, so some of these come in pairs, okay? There's the frontal bone in yellow, the temporal bone in orange, that's the side of the skull. There are 2 of them. And then the sphenoid bone, which is in pink. That's another one where you want to look at it in its isolated form to find all of the features, because it's kind of like embedded in the skull. So it sits behind the ethmoid bone. So you really would have to kind of cut through here, lift off the top of the cranium to be able to see both the ethmoid and the sphenoid bones, okay? So let's talk about the ethmoid bone first. So this is a picture showing you what the ethmoid bone looks like if we could isolate it out of the skull. And then this image is showing you what the ethmoid bone looks like if you were to kind of take a sagittal section of the skull and look at it that way. And then here it is like within the face, so you can kind of see how it sits behind the nasal cavity. So again, the ethmoid bone is obscured by other bones. So to see it, you need to look either at a sagittal section of the skull or you need to look at it in its isolated form. The lab manual is organized nicely as well, or like the chapters that I give you for each of these, because they will lay out the bone and they will tell you, it'll have bullet points of the features that you need to know. So you can systematically work through the lab manual at the same time. So now that we have identified what the ethmoid bone is, now let's look at some of the features. Oh wait, I have one more picture. Sorry. This is actually a really great picture where it's showing you highlighted in orange how the ethmoid bone is sitting kind of behind the nasal bones. So these are the nasal bones here and here, and the ethmoid bone is sitting behind it. So these are the features. So each slide, as I work through this, will highlight the features that I want you to know. And then I have a series of slides kind of pointing to where those features are. But it is critical to sit down in lab and actually find them with your hands and your eyes and touch them. So studying just from the lecture or from pictures doesn't always do it the justice of sitting in the lab and looking at the bone yourself. So the features that I'm going to go over are the crista galli, the perpendicular plate, the ethmoid sinus, the cribriform plate, and the olfactory foramina. Now let me also be clear that sometimes I will tell you what these features, what the function or the purpose of these features are, but I don't necessarily need you to memorize what these features are doing. I'm just going to tell you because sometimes it helps bring some perspective into what these features are. But on an exam or the practical, I will only ask you what the feature is, okay? So, for example, if I labeled this, which I'm gonna start telling you what all the features are, you would answer it is the perpendicular plate. But I will go on to tell you a little bit more about it just so you have some reference. So if you take the ethmoid bone and you're holding it in your hand, the first thing to do always is to orient yourself. And there's a couple of features that allow you to know what is superior, what is inferior, okay? So the perpendicular plate, which is highlighted in green, is a piece of the ethmoid bone that is going to go on to form part of the nasal septum, okay? That is the perpendicular plate. Here are a few of the other features. So there are two important features here that I want to highlight. The cribriform plate and the olfactory foramina. Okay, foramina is plural for foramen. So they are tiny little holes. So the plate is this whole area right here and right here. That is the cribriform plate. And on the cribriform plate, you will find many little holes, and they are the olfactory foramina. That is actually where the olfactory nerves travel through. All right, so the cribriform plate is the whole piece, and the olfactory foramina are the little tiny holes that the nerves are going to run through. And this is how we are going to have our sense of smell. All right, let's move on to a couple other features here. So I told you that inferior, like kind of pointing in the inferior position, is the perpendicular plate. In the superior position is something called the crista galli. So it's like a sail-like projection. It's located on the top portion of the ethmoid bone. So you can kind of see how the ethmoid bone is sitting, and here is the crista galli right here. and it serves as an anchor point for the brain and kind of prevents the brain from moving. So again, the reason and why and the function, I don't need you to know, but if it helps you kind of remember what the feature is and how to orient the bone, I think that it's worthwhile to explain. All right, and lastly are the ethmoid sinuses. So sinuses are large hollow spaces. So they're air-filled spaces that kind of make up like the nasal cavity. And you're going to find epithelium, respiratory epithelium that is going to line these cavities, all right? They're air-filled. So that's what is highlighted here. All of these kind of little spaces here are the ethmoid sinuses. These are hollow cavities. They're on both sides here. Now, I also want to point out that there are many more features to these bones than what I'm going to go over or hold you accountable. And I know that this tends to be a little bit overwhelming because we're going to talk a lot about a lot of bones and a lot of different features. But just work through it systematically and you will get through it. The atlas also helps with bones and muscles in this unit too. This is a frontal view over here of what those ethmoid sinuses look like. And here's a sagittal view of what those ethmoid sinuses look like. All right, let's move on to the occipital bone. Again, the occipital bone is here in green. It's what makes up the back of the skull. And you can see it in various views here, whether you look at an inferior view of the skull or a sagittal view. Okay, here's like a lateral view. You can see where the occipital bone is. Here's a bigger image to show you over here. There are a lot of features to the occipital bone that I'm about to go over. So these are the 8 features that I want you to know. I'm going to tell you that a couple of them are a little hard to find. And the clue that I always tell students is if we can't find it on the skull, I probably can't ask it on a practical. So we'll do the best we can when we get in the lab to try and find these. But there's a couple of them, and I'll point them out as I talk about them, that are a little bit difficult depending on whether we're using a real skull or the fake skulls. All right. Foramen magnum. This is a very large hole. Magnum means large. Foramen means hole. The occipital condyles, I'll show you those. The jugular foramen. These are the 2 that I'm not sure that we'll be able to find. The superior nuchal line and the inferior nuchal line. I'll show you where they are though. There is an external occipital protuberance, posterior cranial fossa, and a hypoglossal canal. Let's work through those. All right. So if you look at the back of the skull, sometimes you can make this out. So one that I'm pretty sure you can find is the external occipital protuberance. So if you take your fingers and kind of palpate the back of your skull, you can feel the external occipital protuberance. And there are a lot of muscles that attach to this region of the skull. The 2 features that I'm not 100% sure that we'll be able to find, I know Miracosta has real skulls, whereas at Palomar we mostly have fake plastic ones, and it makes finding these lines a little bit harder. I feel like some text got lost. My PDFs are not converting as well as I had hoped. Anyway, these are those superior and inferior nuchal lines right here. All right, and these are sites of muscle attachment and ligaments as well. So those may or may not be there when we get to the lab. But let's move on to ones that I know will be. All right, these are the occipital condyles in pink, right here, okay? And the skull is going to articulate, right? There's going to be a union of the skull and the very first cervical vertebrae, which is called C1, the atlas. That is where the skull is going to sit down on that very first vertebrae. Okay, so you see these little condyles, they're little smoothened regions right here on the side of the skull, and that is what's going to articulate with the atlas. All right, now if we kind of take the base off of the skull, and you might have to use the plastic model for this one, okay, so that you can see all of these features, because you need to kind of cut the top portion off. There's a few holes that we should discuss. So the first one, let's do the foramen magnum. That is this big hole right here, foramen magnum, large hole. That is where the brainstem and the spinal cord are going to travel down. That's the foramen magnum. Immediately lateral to that are two little holes, and they're called the jugular foramen. They're on each side. Okay, the jugular vein is going to travel through that hole. And then on the side here, let me erase what I've done here. On the side of the foramen magnum, there are two little holes. And they are called, that is the hypoglossal canal. And that is where the hypoglossal nerve is going to travel through. So try to identify all of those, okay? There's the jugular foramen right there. All right, then there are some smoothened areas. Remember, fossa meant smooth area. Smoothened area. So again, if you can kind of take the top portion of the skull off, you can notice two areas. So there's what's called the posterior cranial fossa. Because remember, the occipital bone sits in the posterior region. We're going to come back to this one. So this whole sort of smoothened areas right here, that is the posterior cranial fossa. And this houses the cerebellum and the brainstem. All right, let us move on to the parietal bones. So there are two parietal bones, one located on each side of the skull. Okay, so you can kind of see some images here, a sagittal view. Here you can see both of the parietal bones if you're looking at it from the posterior side. That's the posterior view. The good news is there are no features to the parietal bones that you need to memorize. So you just need to be able to identify the parietal bones. All right, let's talk next about the frontal bone. Here is the frontal bone in yellow. Here it is in blue. There's a couple important features to the frontal bone. All right, so there are 6 features that I'm going to go over. I'll tell you what the features are, and then I'll show you where they are. So they are the glabella, the superciliary arch, the supraorbital margin, the supraorbital foramen, there is a frontal sinus, and then there's the anterior cranial fossa. We just looked at the posterior cranial fossa. That was part of the occipital bone. Now we're going to look at the anterior cranial fossa. All right, so let me show you a couple of these features. So let's talk about the glabella first, is kind of this area in between the eye sockets. All right, it's a smooth area right here, is maybe a little bit higher, is the glabella region. All right, the supraorbital margin is this bony feature that makes up this eye socket right here. Okay, that's the supraorbital margin. And there's actually a difference, this is just FYI information, between males and females. So if you were to try to identify, if you have found a skeleton and we're trying to distinguish whether it was genetically male or female, there are several features that we'll talk about as we go through the lectures that distinguish this. And the supraorbital margin is one of those. And it is usually rounder and more pronounced in a male, and it is a little bit sharper and thinner in a female. Okay? And then there is the superciliary arch. That is the brow line. So right about there, the superciliary arch. That's another distinguishing feature. It's a little bit more prominent in men and a little bit less prominent in females. And there is a foramen. Let me kind of take away this. There is a foramen, although sometimes it appears as a notch right here and on the other side too. Right here. That is called the supraorbital foramen, and in parentheses notch, because sometimes it goes all the way through and sometimes it doesn't. It's a passageway for nerves, arteries, and veins. Here, again, if you kind of take off that top portion of the skull, you can then make out the anterior cranial fossa. And this houses the frontal lobes of the brain. There is a frontal sinus, so if you carve away that frontal bone area, kind of right behind the glabella region, there is a frontal sinus here. All right, let's move on to the temporal bone. That is what is shown here in orange. There are 2 of them, and we will go over 5 features for this bone. So we'll talk about the external acoustic meatus, the styloid process. Remember I told you there was a styloid process. It looked like a stylus pen. The carotid canal, zygomatic process, and the mastoid process. So let's take a look at these features. All right, the zygomatic process, that is right here. That's probably not the best color for that. That makes up kind of like where the cheekbone area is going to be. That's the zygomatic process. And again, a lot of these features have to do with muscle attachment. So when I start talking about the facial muscles, the muscles of facial expression, it is important to memorize these features because you're going to see where these muscles attach, and they're going to attach to these features. Here is the external acoustic meatus. This is the ear canal that will lead to the eardrum. And I think I separated these features. Okay, yes, here, let me make this a little bit smaller. Here's that styloid process right here. Oftentimes, and this is another attachment site for muscles, if you're working with real skulls, lots of times the styloid process is broken off because it's very, very fragile. Another important feature to the temporal bone, which is a site of muscle attachment, is this mastoid process right here. All right, if we take an inferior view, we're going to find the carotid canal. So remember, I showed you, let me switch over, the foramen magnum, that was part of the occipital bone. And then we talked about the jugular foramen, where the jugular vein is. If you look just superior to the jugular foramen, you're going to find the carotid canal. And that is the canal for the carotid artery. All right, so you can see them here and here. So you need to have reference points for all of this, because if you're just looking at the skull in the inferior view, you're going to see a lot of holes, and you want to have a reference point. So sometimes the best thing to do is to find the foramen magnum, find the occipital condyles, and work from there. All right, now we are on to the last bone that makes up the cranium, and that is the sphenoid bone. The sphenoid bone is also difficult to see. Remember, it sits behind the ethmoid bone. So you can see various views of it. Here's inferior view, but again, it's kind of embedded here. So the best thing to do is find an isolated version of the sphenoid bone and try to identify the features. There are kind of a lot of features to this sphenoid bone, okay? And we'll work through them systematically, and then when you're in lab, try to work through them as well. So there's 9 features to the sphenoid bone. Here is a nice view. If I forget to mention this sooner, I'll mention it now, since this diagram is labeled with KenHub on it. KenHub is a great internet source for anatomy. So if you have any questions, I get a lot of my pictures sometimes from KenHub because they're color coded and it shows you exactly where the bone is sitting. All right, so these are the features. There are 9 of them. Let's just go over them in picture format. So since we're here, I'm going to tell you about one other website. So we talked about KenHub. That's a great website. The second one is called Teach Me Anatomy. It's all one, but I'm going to run out of room, I think. Nope. Okay. So I got this picture from Teach Me Anatomy. And I definitely think there's something with my PDFs because I'm missing some words here. So Teach Me Anatomy had this sphenoid bone nicely color-coded, so I really liked it because I feel like it's a great way to teach off of. So it highlights the body of the sphenoid. It kind of looks like a butterfly or a dragon. You can think of it in any way that helps you. There are, the lesser wings are in green, so that's what you see here. And the greater wings, which are bigger, are seen in kind of brownish red. And then there's what's called the pterygoid process in yellow. All right, so let's work through some of these features. I actually have, I don't know if it's a mnemonic as much as it is abbreviations that will help you with some of these features. So if you remember, this bone sits behind the ethmoid bone. It sits behind the nasal cavity and the eye socket. So what you're going to see here, there's 2 holes right here. This is the optic canal. This is where the optic nerve is traveling through. And then a fissure, which is bigger than a foramen. So you can see how it's bigger than a foramen on each side here. That is called the superior orbital fissure. And then there's a series of holes on the greater wing. Here, there's 3 of them. And I had a student that came up with a way to memorize them, so I'm going to pass it along to you. But let me first tell you what they are. So the very first one is the foramen spinosum, foramen ovale, because it looks like an oval, and foramen rotundum, because it's circular. Okay, so it's an acronym. The acronym that a student came up with was SOAR, because if it's a butterfly or if it's a dragon, it's soaring through the air. So spinosum, ovale, rotundum, okay, to help you memorize them. And then the same student also came up with the acronym SOAR-SOF. Again, you don't need to use this if you don't want to. I'm just providing you with something, which is SOAR are the 3 holes, and the SOF is the superior orbital fissure. So if that helps, great. All right, all of these holes are passageways for nerves to travel through. Let's see, what else do we need to cover? Oh, if you flip the sphenoid bone to the other side, okay, there is a little depression here, and that is called the sella turcica. So again, we're looking at it from a different angle than this first picture, okay? So we flip it over. There's this region here that I've kind of highlighted in pink called the sella turcica. That means in Latin, Turkish saddle, because it looks like a saddle you would put on a horse. And that is where the pituitary gland sits. The sphenoid bone has a sinus associated with it, and you can really only see that in a sagittal section. It's really kind of hard to make out. I'm not even sure we have a model that would show you the sphenoid sinus, but I did want to mention that that bone has a sinus. All right, so we just went over all of the cranial bones and all of the features. The next part of the lecture is going over the facial bones and their corresponding features. All right, so for the facial bones, there's 14 of them. Many of them come in pairs, though. The mnemonic that I found, again, same place I found the other mnemonic, is my mandible chews 9 very large zucchini pizzas. Again, it's important to be able to recognize and identify all of the facial bones and to be able to recall what they are. So we are going to go over the mandible. Okay, that's the lower jaw. The maxilla is the upper jaw, and that's actually 2 separate bones. There's a separation between the 2 bones. We will talk about the nasal concha, the nasal bone, which I think is here in green. It's kind of hard to see. The vomer, the lacrimal. The lacrimal bones are located in the eye sockets here on the sides. I'll show you that, a better picture. Zygomatic bone, which is in yellow, and the palatine bones, which are on the roof of your mouth. So let's work through these bones and the features that I need you to be able to identify. Many of these will be seen on the practical. You'll have all of the bones around the lab. I will put little stickers on them, and you will have to recall the names of the features or the name of the bone. So there's really not a multiple choice situation. You have to know them well enough to be able to recall them. All right, so let's talk about the maxilla first. The maxilla is the upper jaw. there are 4 features of the maxilla. Here's the same kind of setup as before. You can see various views of the maxilla with various angles of the skull. All right, so 2 of the features are on this slide. Or no, actually only one of them is on this side. So there is a hole on each side. Here it is called the infraorbital foramen. And this is a passageway for arteries, veins, and nerves. There is a sinus associated with this bone. So sort of superior to it is what's called the maxillary sinus. That's here in purple. All right, if we take an inferior view, we can see in green the palatine process. So there's 2 of them. Those are the palatine processes. They form the nasal cavity, like the floor of it, as well as the hard palate. The other portion is called the palatine bones. These are not associated with the palatine process or the maxilla. These are separate bones. Okay, so when you're looking at the maxilla, you want to kind of focus on the area that is closest to the teeth here. You will see something called the alveolar margin on both the maxilla and the mandible, because it is the ridge line between the bone and the teeth. So it is this line here. I'm going to try and draw it the best I can. That is the alveolar margin. All right, so did we go over all of the features? I feel like we're missing something. No, I guess that's it. Okay, just wanted to be sure, sorry, not to confuse you. All right, we went over the alveolar margin, and now the mandible. The mandible does have a lot of features. I think I have them all summarized on the next slide. The mandible is the lower jaw here. And let's talk about all the features. I was able to put them all on one slide, so hopefully that makes it easier. So we already went over the alveolar margin. That's the ridge line right here. Okay. There is a hole located on both sides of the mandible called the mental foramen. This is a passageway for nerves as well, and arteries and veins. Lots of times if you're getting dental work done, they will target this nerve so that you don't have sensation when they're filling a cavity, let's say. All right, so let's start. How about we'll start at the coronoid process that's here. So there's these 2 processes that kind of stick out of the bone on each side. The most anterior one is the coronoid process. This is a projection right here. And then on the other side, more posterior, is the mandibular condyle. Okay, so it's the coronoid process is here and here, and the mandibular condyle is posterior to that. And these are attachment sites, or serves as like where the joint is for the jaw to open and close. The coronoid process it serves as an attachment site for muscles. All right, in between those 2 processes is this dip right here. That is called the mandibular notch. That's a depression between the coronoid process and the mandibular condyle. And then we have the ramus. All right, the ramus is this whole area here. Okay, it's kind of like this part right here is the ramus. That is the ramus of the mandible. There is an angle that then forms as it curves to the front here. That's the mandibular angle. So those are the features of the mandible. We also have the mandible isolated. So you could work from the isolated mandible to find all of these features. All right, the nasal concha. So inside the nasal cavity, they kind of look like little speed bumps here, little bumps. Those are the nasal concha. And they're located within the nasal cavity. They are there to create turbulence. We'll talk more about this when we get to the respiratory system. But as air flows through the nose, we want to move that air around so that if there are particles in the air, we want that epithelium that is surrounding the nasal cavity. It has cilia on it, and we want the cilia to kind of capture those particles and make sure that they don't end up in our lungs. The nasal concha do not have any features. You can see the nasal concha we have, and what you need to do when we are in lab is to look or ask me for the half head model. It is a plastic model that is a sagittal section of the head, and you can see the nasal concha in that model. Okay, the nasal bones, so here in peach are the nasal bones. There are no features to the nasal bones. It is just merely a reminder that most of our nose is made up of cartilage, and there are, just like the bridge of the nose is the only portion that's actually bone. All right, the vomer, I think I have a better picture of the vomer, I do. So here it is in pink. It is going to form the other part of the nasal septum. So we had already talked about the perpendicular plate. Remember the perpendicular plate of the ethmoid bone forms the top part of the nasal septum. The vomer forms the bottom part of the nasal septum. Okay? Those are the two pieces that come together to form the nasal septum. And that's what separates the left and the right nasal passageways. All right, the lacrimal, it's kind of hard to see. You can see it here in pink. Those are the lacrimal bones. You can kind of think of this because when we talk about vision, we'll go on to talk about lacrimal glands. This is kind of where your tear ducts are. So there's two bones there called the lacrimal bones. Okay, you can kind of make them out nicely in this picture. Kind of shows them here too. These are the smallest bones of the skull. They are deep in the orbital region of the eye socket, is where you can find the lacrimal bones, and there are no features to this bone. Lacrima means tears in Latin, so that's why I was telling you kind of where it's located to kind of remind you that if you were to try and look for the lacrimal bones, to kind of think of tears, and that's where you would find those bones. All right, the zygomatic bone, that's shown here kind of in orange peach. You can see it here. So that is another area where your cheekbone is the zygomatic bone. There's two of them, and there are no features to the zygomatic bone. You would just need to identify them on a skull. We talked a little bit about the palatine bones when I was telling you about the palatine process. The palatine bones are shown in blue there on the skull. There are no features to the palatine bones. All right, we're nearing the end. You're hanging in there. We're almost there. All right, this bone, it doesn't really fit with the skull because the hyoid bone is the only bone in the body that does not articulate with any other bone. It is kind of, it looks like it's just kind of hanging there by itself, but in fact, it is kept in place by muscle attachment, but it is not bone-to-bone contact with any other bone. There's really no features to the hyoid bone. The hyoid bone is going to it's going to sit right on top of the larynx, which is the voice box. So the larynx is behind here, and here's the trachea for some reference. There's very few features to the hyoid bone. You have the body of the hyoid bone. You have a lesser horn here and a greater horn. The hyoid bone is one of those bones that has a lot of muscles. A lot of our neck muscles are attached to the hyoid bone, and we use it for speech and swallowing. All right, the last topic I'm going to go over are the sutures of the skull. All right, so there are 4 sutures that you need to be able to identify. The coronal suture, and if you remember the coronal plane, like wearing a crown, that is what is shown here. That is the coronal suture. So each of these bones were formed separately in the skull during development, and then they fuse together. And there are suture lines. We talked a little bit about this when we were talking about joints. There's a sagittal suture that is running along the midline. There's a squamous suture here along the temporal bone and the parietal bone. And then there is a lambdoid suture, kind of forms like an upside down V, between the parietal and the occipital bone. So also take a look at all of the sutures and make sure that you can identify them all. I think that wraps up this lecture. Next lecture, we'll talk about the muscles of facial expression.